Dear students, today I would like to continue my first lecture about the female genitalia organs. So here you can see the summary of the uterus. I finished my earlier lecture with the anatomy of the uterus. But now it is really important to repeat that because it is really necessary for this topic, what I would like to describe you today, the implantation, the fertilization, and so on. So that's why I would like to repeat with you this one. So the uterus has two main parts. The upper part is called the body of the uterus, and the lower part is called the neck of the uterus or cervix. And we can divide the cervix into two main parts. That which is located within the vagina, this is called the vaginal part of the cervix or portio vaginalis. And above you can see the supravaginal part of the cervix. The next picture shows you the cavity of the uterus. Here you can see the cavity, which has a triangular shape, which will continue to the cervical canal. And there you can see the external orifice of the uterus here on the top of the portio vaginalis. Between the cavity of the uterus and the cervical canal, here you can see the internal orifice of the uterus. These are the layers of the wall. The outermost layer of the wall is called the perimetrium, consists of the simple squamous epithelium, the layer of the peritoneum. After, the next is the myometrium, which consists of smooth muscle cells. And finally, the innermost layer is called the endometrium. This picture was a very important part of the first lecture, so I would like to repeat with you again. Here you can see the hormonal regulation of the whole menstrual cycle. So at the top, we can find the hypothalamus. The hypothalamus will produce the gonadotrope-releasing hormone, which will regulate the hormone production of the anterior pituitary. The anterior pituitary will secrete the FSH and the LH. The FSH is the follicular stimulating hormone, which will be important in the development of the follicles within the ovary. And here you can see the hormone level of the LH, which will form a peak few days before the ovulation. This is the luteinizing hormone, which will be important in the stimulation of the ovulation. In this picture, you can see the growing of the follicle, which is not correct in this case, which will show you only just one menstrual cycle. Because the growing of the follicle from the primordial follicle until the tertiary follicle, this is more 5-6 months, so it's a long time. And within one cycle, one part of the cycle, we will choose some tertiary follicles which will grow so fast. And in the middle of the cycle, because of the effect of LH, it will ovulate. And after the ovulation, here you can see the corpus luteum, which will produce progesterone. So here we can see the changes in hormone levels, the estrogen and progesterone levels. The estrogen, we can find estrogen in the first phase and also in the second phase of the cycle. But the progesterone will be higher in the second phase of the menstrual cycle when the corpus luteum will start to produce progesterone. Here, the last picture shows you the changes within the endometrium during the menstrual cycle. The menstrual cycle will start with the menstruation, when the upper functional layer of the endometrium will fall down, and after will start the proliferation of the endometrium, where from the stratum basale will proliferate the glands and the stroma, and the endometrium will grow. And after the ovulation, because of the effect of progesterone, this functional layer will change. The glands will start to secrete nutrients, which will be stored within the cells of the endometrium. These are called the pre-deciduous cells. And because during the cycle, what is the function of the menstrual cycle? To build up the whole endometrium, for that to be able the implantation of the embryo. So the implanted embryo will eat these cells, this nutrition, which is secreted by the glands here in the second phase of the menstrual cycle. So we can divide the menstrual cycle into two main parts. The first 14 days is the proliferative stage or estrogen stage or follicular phase, and the other is the luteal phase or secretory phase or progesterone phase. So here you can see again the histology of the endometrium. We can see two slides there. The first is from the proliferative stage, and the second is from the secretory stage of the endometrium. You can see that we have very huge differences. The second part is much more thicker compared to the first one. In this picture, we can see the border between the myometrium and endometrium, here in this part and here that. The first layer of the endometrium will be the stratum basale here, which is similar in both slides, because from the stratum basale will start the proliferation, the growing of the functional layer of the endometrium. And here you can see the functional layer, which is much more thicker here in the secretory phase. If we see the higher magnification of the proliferative phase, proliferative stage of the endometrium, here you can see the glands. They have not so big lumen, they are just growing, proliferating. And here we can see the stroma between the glands. And the epithelium is simple columnar epithelium with gynoecilia on the surface. And what's happening after, because of the effect of the progesterone, these glands, they start to secrete. They will be much more bigger. They have bigger lumen. And that's why this part where we can see these glands is called stratum spongiosum, like a spongy. And after, the uppermost layer is called stratum compactum, because here the cells, the stroma cells, they will grow, they will store a lot of nutrients inside. So that's why they have an epithelioid shape, and they will be close to each other to form the uppermost compact layer of the endometrium. Why is it important that? Because, of course, I told you the function of the menstrual cycle is that at the end of the menstrual cycle, the endometrium is waiting for the implantation. It is ready for the implantation. When does it happen? In the case of fertilization. Here you can see the ovary, and this is the fallopian tube there, and the cavity of the uterus. In the middle of the cycle, here you can see the ovulation, and after, the oocyte will go within the fallopian tube, and the fertilization will be there at the level of the ampulla, and after, it will start to proliferate. We have second cell stage, full cell stage, and so on. And after, in the blastocyst form, will start the implantation. All of the details of these developmental stages, you heard it in embryological lectures. Of course, I do not want to tell you again, please repeat this. But these main theoretical definitions, they are necessary to understand the implantation. So, 5-6 days after the fertilization, we'll start the implantation within the cavity of the uterus. And those cells which will form the outermost cells of the blastocyst, they are the trophoblast cells, and they will produce the human choriogonadotropin hormone. And that is what we can test with pregnancy tests, because 5, 6, 7 days after the fertilization, this hormone level will increase within the blood, and we can show it with special examination. How does the endometrium, how does it change during the pregnancy? Here you can see that the uppermost layer of the endometrium, which is called stratum compactum, it will be enlarged, it will be much more bigger. Here the pseudo-deciduous cells, they will change and they will be decidua cells. The decidua means the pregnant cells of the pregnant endometrium. Here you can see the bigger magnification of the decidua cells. They're very huge, big. They contain glycogen lipids within the cytoplasm. They will be the nutrition of the implanted blastocyst at the beginning of the pregnancy until the placenta is not able to supply the baby. Here you can see the schematic picture about the implanted embryo. This picture can show you what are the main parts of the decidua. We can talk about decidua parietalis, which is located there on the surface, on the lumen of the uterus cavity. And after, the next part is the decidua basalis, which will form the maternal part of the placenta. And around the implanted embryo, here you can see the decidua capsularis. Only just at the beginning of the pregnancy, only just this stage, those layers will be separated, because later, when the embryo will grow, this lumen will disappear and these layers, they will fuse. Let's see the changes during the pregnancy, the changes of the shape of the uterus or the size of the uterus during the pregnancy. Here you can see at the beginning, in the first trimester, and after, at the beginning of the second trimester, here you can see how big is changing, the shape is changing during the pregnancy. And finally, this is the end stage, this is the cervix. The isthmus will fuse to the body of the uterus, and the cervix will be the very important basal part of the uterus, which will hold the body of the baby and the head of the baby. It is really important to tell some words about the development of the placenta. I know that it is not so easy to understand it without embryological knowledge, but I would like to tell you some important definitions. So I told you that the placenta has two main parts. The one part is the maternal part, which was the decidua basalis, and the other part is the embryonic part, which are finger-like protrusions, and this is called the chorionic villi and chorion frondosum, the name of this part of the embryo. So here you can see the development of the placenta, how there's a finger-like protrusions, how this chorionic villi will grow and will produce into the decidual layer into the maternal side. So this is the first step when these outermost cells of the blastocyst, which are called trophoblast cells, syncytial trophoblast cells and cytotrophoblast cells. First, we have only just these protrusions, which are called the primary villi. And these primary villi, they will grow into these smaller spaces which will be filled with maternal blood, as the sinuses which will be filled with maternal blood. After, into this primary villi will penetrate embryonic, chorionic mesoderm and embryonic connective tissue, and within this layer will develop the vessels of the embryo, the umbilical vessels. So here you can see the structure of the tertiary villus, which consists of umbilical vessels, extraembryonic mesoderm and trophoblast cells, and they will produce into this very special cavities, sinuses, which will be filled with maternal blood. So this is which will form the connection between the circulation of the embryo and the circulation of the mother, but it is really important to understand that the two types of blood, they do not mix. We have a border, we have a very important border between the circulation of the mother and the circulation of the baby, what I will tell you later. So, but here we can see also there, so this is the blood of the mother in the maternal side, in the decidua and the maternal side, and this is the blood of the baby. So between we have a trophoblast cells, the extraembryonic mesoderm, so these layers will form a barrier between the two parts. This is the higher magnification of the structure of the placenta. So this is the embryonic part, which consists of the layers of the embryo, so amniotic layer, and the chorionic plate, which consists of a chorionic mesoderm, this connective tissue, and the trophoblast cells. They will form these finger-like protrusions, which are called the chorionic villi. And these chorionic villi, they will flow, they will produce into the intervillous spaces, which will be filled with maternal blood. And after, if we continue, we have a little small layer which consists of trophoblast cells from the embryonic part, which will cover the maternal surface. And after, we have a fibrin which will develop between the maternal and the embryonic part of the placenta. But after, here you can see the decidua basalis, which is the maternal part of the placenta. And the last layer, this is called the myometrium. And from the maternal part will develop maternal septa, decidual septa, which will form the smaller units of the placenta. What I will show you later is called cotyledon. After the birth of the baby, of course, the placenta will leave the wall of the uterus. And here you can see that layer where the placenta will be separated from the wall of the uterus. The higher magnification of the barrier, what I told you, between the blood of the baby and the blood of the mother. So the blood of the mother will be around, like this. The blood of the baby is located within the umbilical vessels. So the first layer is the endothelium of the vessel and the basement membrane, and after the chorionic mesoderm, and afterwards you can see the trophoblast cells, the cyto and the syncytial trophoblast cells, and this is the maternal blood. In the third trimester, and this barrier will be smaller because the cytotrophoblast cells, they will disappear. You can see the vessels, they are attached to the syncytial trophoblast cells. So that's why, of course, here we have a smaller barrier, so more sensitive to other environmental effects. And it is really important that the maternal and the fetal blood do not mix here, you can see in the schematic picture. This shows you the placenta. The smaller unit of the placenta, as I told you earlier, this is the cotyledon, which is separated by the maternal septa, originated from the maternal part. Here you can see. And this is the picture from a placenta after the birth. It is really important to examine the whole shape of it, because if, for example, one of the cotyledons will remain within the cavity of the uterus, after this can develop inflammation, of course, or the uterus is not able to contract, and unfortunately can lead, for example, bleeding, or in very severe cases, maybe the death of the mother. The placenta, it has really important hormone production, as I told you, the progesterone, estrogen, and so on. And I told you that this barrier between the mother and the blood of the baby, of course, there will go the oxygen, the carbon dioxide, and the nutrients too. But unfortunately, the drugs, the nicotine, and also inflammation viruses and other toxic agents are able to pass through too. That's why we have to take care, because unfortunately those environmental effects, they can cause developmental malformations. And here you can see the cross-section of the umbilical cord, the two umbilical vessels, the two umbilical arteries, and one umbilical vein. They are embedded within a jelly-like material. It's called Wharton's jelly. This contains a lot of water for the protection. It protects the vessels against the contraction within the cavity of the uterus. During the pregnancy, of course, we can test the cells of the embryo. For example, with amniocentesis, because in the amniotic fluid we can see cells, we can find cells originated from the embryo, so that's why we can check the DNA of the embryo, and we can show developmental malformations, genetical malformations in this examination. It is really important to do after the 35 year, because later lot of developmental malformation could be in the older ages. The next part of the female genitalia, this is the cervix, and here you can see the vaginal part of the cervix and the external orifice of the portio vaginalis. This is one without pregnancy. Multipara means after delivery. You can see the shape of the orifice will change. Why is it important to know it? Because one of the most frequent female tumors, unfortunately, will develop from this part of the uterus. It is a cervix carcinoma. One of the most famous women who died there, she was Eva Perón. This tumor grows so slowly, so that's why if we go to test it every year, we can protect our cells with this very simple examination with the Papa Nicolau staining. They can check the cells from the surface of the cervix and they can see abnormalities and we can treat it immediately. And now we have very special treatment because we have injection, vaccination against the human papilloma virus. What the young women they can get around year 12 years old, and this is the way how we can treat how we can do pre-medication or protection against this disorder. But it is really important the screening every year. The last part of the internal female organ is the vagina. Here you can see the wall of the vagina, the fornix of the vagina, where it will attach to the cervix. We have transverse rugae vaginalis within the wall, and this is the orifice or vestibulum of the vagina when it opens to the environment. Within the wall we can see the hymen, which is a developmental remnant. It could have a ring shape or like a cribriform shape, which is located there in the wall of the vagina. The epithelium of the vagina is stratified squamous non-keratinizing epithelium, which contains a lot of glycogen inside. It is really important because these cells, they will be the nutrition of those bacteria which are located within the lumen of the vagina. These are the duodenal bacteria, which will form lactic acid to help to form the low pH of the vagina, which is important in the protection against different inflammation like candida and other bacterial and virus inflammation. And finally, this picture, you can see the structure of the external genitalia. In the middle, here we can see the vestibule of the vagina, which is bordered by the lesser labia minoris pudendi, and the major labia there, great labia around. Here you can see the clitoris and the frenulum, which will cover it. There into the vestibule will open the greater vestibular glands, and there we can see also the vestibular bulb there, which will surround the vestibule. On the top you can see the mons pubis, and in the lower part there is the anus, the opening of the anus. And here you can see also the muscles which will form the urogenital diaphragm, but these details, they are not important to know all of the details for the pharmacy students, but all of the details of the genitalia you can see in the practices. Finally, I would like to thank for your attention and good study for the exam.